Today, one of the most prominent Māori health advocates, Lady Tureiti Moxon, is taking a warning to the United Nations about New Zealand's health system and Indigenous access to it, filing a formal human rights complaint. And she joins us now. Good morning.
Morena.
Morena, good to see you. So how does this work? What do you actually do with the formal process? How does it work?
Well, we will be heading to Geneva this evening, and we will have time with the committee to discuss our issues and the things that we think are very important to be speaking with the UN about in terms of the racial discrimination, really, in our country and the issues that we have been faced over the last wee while. And then we will have an opportunity to have a 3-minute spiel to speak to them, and then we hopefully will be able to see the response from the Crown delegation that are going over.
When you say racist health system, can we be very specific about what we're talking about? Because I think in this country, there's been a tendency for one side to say everything, the health system is racist, and the other side to interpret that as meaning that it's a deliberate undermining of Māori health. So when you say that, do you mean that our doctors and nurses are racist and they are saying, I'm not treating you or I'm not following that up because you're Māori or you're brown?
Well, what we have are inequities in health. So basically that means that we have a system that does not treat Māori in the same way as is being told to the whole public that they treat others. For example, we die 7 years younger than everybody else. We die twice as much from every single cancer than everybody else. We die twice as much from cardiovascular disease. We die twice as much from just about every disease there is. And we do not get diagnosed in time. And that is part of the issue. So every single time somebody presents to the hospital or presents to their doctor, they are not necessarily given the same options and opportunities as others. For example, there was a piece of research that was done, and that piece of research basically showed very clearly that a lot of those who had asthma were not offered the preventative for asthma. They were offered just the Ventolin, which would stop asthma at that time. And yet, believe it or not, Māori have the highest rate of lung cancer in the whole world. So, when you look at statistics like that and data like that, and the research is saying that the health system is not treating Māori in exactly the same way as they're treating others, then you've got to say there is a problem here.
Totally agree there's a problem. What you mentioned, lung cancer, sadly, Māori also have a higher incidence of tobacco consumption, of smoking. So some people might say, well, is that the health system's fault? Is that not contributing to the very, some of the statistics that you're talking about?
It's the funniest thing, but the way in which we promote products in our country, and, smoking was something that everyone did socially, and it was all touted out to be, the most amazing thing to do. And then we find out much later that smoking is actually killing us, right? And then what does our government do just recently? They go and change the law. They change the legislation. They lift the regulations around it. They lift it off, so it makes it easier for tobacco companies to come in and sell their wares. And so what we've got now is another issue, and that is vaping. So we have a government that puts together an advisory group, and then they put on people from tobacco companies to talk about what's the best way forward in terms of health for our people. Vaping is the way forward. But what we know, and from the respiratory from a respiratory conference I just went through, the Respiratory Foundation, is that vaping has huge numbers of chemicals in it that are actually detrimental to our health. And it is hugely addictive. And we've got little babies, our little children, smoking it. And they are being addicted as children.
Yeah, it's terrible. Lady Tureiti, I just want to ask you this question, and it's a genuine question. You're off to the UN, you're trying to get something done, which I totally understand. But in the process, I mean, you have just mentioned tobacco companies, and they deserve blame. The government needs to be blamed because it's not pulling its weight. The health system needs to be blamed. What about individual? Are we disempowering individuals from making smarter, wiser health choices about their own health? Taking ownership of, I need to stop smoking, I need to do this, I need to follow up on my doctor's visit, I need to take control of my health story, that kind of stuff. Is there a risk, I guess, in one narrative kind of outweighing the other?
Well, it's like anything. We spin the story we want to hear, and we blame the victim. And that's what society has always done. We blame the victim. It's your fault. You could have stopped doing it. You could have done this. You could have done that. But the issue is our governments and successive governments create the problem, and then they get Māori providers to get in there and to try and fix the problem, and then they try and what's the word? Then they try and create a situation which we are in now, which is to save money. And in order to save money, they've got to make money. And so who do they make money off? They make money off the backs of people's misery. That's what they do. And they've continuously done that. And I tell you what, the Commission of Inquiry into Abuse of State and Church is a prime example. And yet nothing has been done. And those victims, those survivors, are all still waiting for something to be done. But they're making decisions quite independently of them. And this goes on and on and on. And they create the problem, and then they expect us to fix it up, and then say to us, just like the vaping example I gave, vapes are going to be a big issue. It actually rots your teeth. And so we're going to have a whole lot of gummy people in the future. So so they create the problem, they make people do things that they ought not to be doing to push products that are basically harmful to our people. And that's been seen time and time again, and yet it continues.